Diabetes mellitus involves impaired insulin secretion and/or insulin sensitivity, resulting in high blood glucose levels. Accordingly, diabetes management strategies aim to restore the blood glucose levels to a normal state while avoiding hypoglycemia. Currently, there are several basal insulin therapies available for treating patients with diabetes, of which degludec has the most stable blood glucose lowering action. Two previous treat-to-target pharmacodynamic studies compared degludec with another insulin therapy, glargine, 100 units per milliliter, or U100, and found that degludec resulted in lower rates of hypoglycemia in patients with equal levels of glycemic control. Now, we have aimed to find out if the converse is true. That is, at similar rates of hypoglycemia, would glycemic control differ between the two basal insulins? To answer this, we performed a post-hoc analysis using patient data from the Switch 1 and 2 trials. The association between the risk of hypoglycemia and HbA1c levels was investigated. Data for type 1 and type 2 diabetes patients were analyzed separately. As expected, we found that increased glycemic control was associated with increased incidence of hypoglycemia for both basal insulins across both types of diabetes. However, patients with type 1 and type 2 diabetes achieved greater mean HbA1c reductions of 0.70 and 0.96 percentage points, respectively, when using degludec compared to glargine U100 at an equivalent risk of hypoglycemia. These findings indicate that degludec may be a better choice than glargine U100 for patients who need insulin intensification.